Okay, hey everybody. So for my job finding activity, I decided to do a nanny because that's the job that I've had for like the past 3 years. So a couple of the words I found um, two different Indeed like job listings because every nanny is a little different, like depending on your family and the child or children. Everybody kind of wants different things. So a couple of things in the way OT can fit in with being a nanny that I come up with. Involve environmental awareness. So just being aware of your environment. So for this, it's a big thing with like safety for our patients. We need to be able to go in and figure out things that could be a hazard for our patients, and things that we can do to help that. And that's true too, like with the boy that I've always kept. I want to be aware of what's going on and what's happening around us because I don't want him to be in danger. Confidentiality. So that kind of goes more for an OT in the healthcare field as far as being sure that we're not sharing information regarding our patients with other people, and that when we're talking about things with other people that work with us, that we're not breaching that confidentiality either. And a lot of times, with the way that we build rapport with a patient, we kind of become a confidant for them, and so they look to us and they trust us to tell us all their struggles and the things that they're dealing with. So, and with that, one of the things, like the Ty and Michelle, the people I babysit for, they don't really prefer that I post pictures of their son, on Facebook or Instagram. And so that's a kind of a confidentiality thing too. If I were ever going to do that, I'm going to ask them. The next one is knowledge of pediatric learning and development. So as OTs, we're obviously in our PEDS class, so we're learning about those developmental milestones, knowing what's normal, typical, and atypical, and being able to help and promote and improve those kind of things. And that's true too when you're a nanny, so you can pick up and help on those learning skills and development with the children you work with. Professionalism, so that includes the way we behave, the way we present ourselves, and the way that we communicate. And that's true in any profession, no matter what you're doing. Being flexible. So here, like, we're dealing with people with all different kinds of diagnosis, all different types of walks of life, and different types of people in general. So we have to be flexible with the way that we plan our care and the way that we treat our patients too, and even just in the day in general. Like, you never know what's going to happen. And that's clearly true with children. Good judgment skills. So every patient we see is going to present with different personality, strengths, weaknesses, diagnosis, and they're going to require different goals for therapy. We have to be able to be an attentive listener, be firm and sensitive in our approach, observant and analytical, and able to plan intervention and treatment individualized. So knowing that each patient's different, and we have to have good judgment skills to assess and go about planning that care. Being organized, so we have to be organized or else we're going to be scattered, so that can go along with the way we document or the way we just go about planning out our day and how we're going to do our caseload of patients or whatever. Being a planner, so that we're able to utilize our time and promote our productivity. So if we can plan out our day, we can get more done, and we know what we're doing. So we're not just lollygagging around trying to figure out something for this patient. We want to have it all planned out. Engagement in activities. So OT as a profession is all about engaging in activities. So it's what we do, but our main focus is on those, meaningful activities to each patient. And these are the basis of our intervention. So engagement activities, that's all you do with kids, is lots of fun activities. So did flexible. Okay. Communication skills. So this is just that we can be an attentive listener, have the ability to explain ourselves clearly, and present a welcoming presence. For communication skills too, with being a nanny, it's important that I can communicate not only with the little boy that I babysit, who's 4, but also with his parents and with his school that he goes to when I pick him up, and everybody. So you just have to be able to talk to people. Being resourceful. So as OT professionals, we are all about being resourceful because a lot of times we have to come up with things based off what we have. So if we have limited supplies or whatever, we need to be creative. So that's that can play into being or planning out treatment interventions, but also creating adaptations for our patients. Emotional regulation. So I just kind of approach this in the sense that when you have those difficult patients to deal with, you can always respond back to them in the same manner that they are given to you, but that's just not necessarily the right way to go about things. So because it is the inevitable that we encounter patients like that, we have to consciously decide that we're not going to respond back in that same manner and use it as an opportunity instead to be super sweet and make the best of that situation. And this is also true with children, because one of my biggest things with little boy I babysit is now he's gotten to the age where he wants to tell me that, well, my mama doesn't do that, or, well, mama doesn't tell me this, and I'm just like, okay. I can't get mad at him because he's just a kid, but it's just one of those things. And then authoritative. So in our profession, we are likely to have opportunities to advance in our positions and lead groups or whatever in our settings too. And we may be required to make decisions or be given chances to control certain situations. So, and that's also kind of in anything too. But with children, you have to kind of set the ground that you are the authoritative role and that they need to, listen and respond to you accordingly. So, those are just some of the things I came up with. And, yeah.